Hi everybody, my name is Thando Zondi-Mredlana. I'm a medical specialist in the field of nuclear medicine here at Smit and Partners in Durban, KwaZulu-Natal. So for us here at Smit and Partners, the highlight for Nuclear Medicine Week this year is definitely theranostics, which is not only the administration of therapy using radionuclides, but also imaging post-therapy. One of the techniques that we have been busy with as a practice is that of spheres or theraspheres, depending on which radiopharmaceutical company you use, and that is the treatment of liver cancer and also liver metastases in different oncological settings. So getting involved in this field requires a lot of background knowledge and understanding of nuclear medicine. The first way that you can get involved is by becoming a nuclear physician, where you would have to study medicine as an undergraduate degree and then proceed to specialize within nuclear medicine as a nuclear physician. The second is you can do pharmacology as an undergraduate degree, and you can then specialize in radiopharmacy within the pharmacological field. The third one is nuclear physics, where you can become a physicist that assists a nuclear medicine department with dosimetry and also monitoring of radiation exposure. And then the fourth one is you could then become a radiographer, where you become a nuclear medicine radiographer or nuclear medicine technologist. These are the individuals that assist us in actually injecting patients with the radiopharmaceuticals and also imaging the patients. So the challenge is actually twofold. We've got a state sector challenge and also a private sector challenge. With the private sector, it's medical aids and also obviously reimbursement in terms of the cost of the studies that we do and including the therapies that we do. And in the state sector, it will always be access, again, to the radiopharmaceuticals and the therapies that are offered. So a lot of the time what we find is the amount of money that is spent in running this department and offering this service becomes a huge hindrance or a problem, which is why we don't find a lot of these departments freely available, especially in the state sectors. So the most recent innovations that we have been involved in as Smit and Partners is that of selective radioembolization of liver metastases from cancer. And this therapy has not only improved patient care, but it has also improved overall survival of the patients and the baseline function of the patients. So the patient experience will definitely depend on the type of study that you have been booked for. Upon arrival, you will be taken by one of our radiographers. A short interview process will be done while an IV line is put up. You will then be injected with the radiopharmaceutical, and depending on the type of study you're coming for, you will wait a minimum or a maximum of 20 minutes to 3 or 4 hours. After which, when that time has lapsed, you will be brought into the camera room where you will be positioned adequately and the images will be acquired. Post-acquisition, that is when these images are then processed so that I, as the nuclear physician, can then do a thorough report, which is generally available over a turnaround period of 24 hours.